Oxcarbazepine or Trileptal have been tried in the treatment for epilepsy for over 30 years. It's primarily used to manage focal epilepsy in adults and children as well. So let's explore the use of oxcarbazepine that might be a better option than the older generation carbamazepine or Tegretol. And we'll discuss important safety recommendations and precautions, especially in Asian populations. While carbamazepine or Tegretol had a long history of treatment for epilepsy, the next generation is oxcarbazepine has been newly used, and it has less interaction and less side effects than the original medicine carbamazepine. So oxcarbazepine is generally better tolerated and has less interactions with other drugs and less liver toxicity or side effect. Also, it has less allergic reaction and skin adverse events, so that overall makes it a better choice to be used for many patients. I'm Dr. Omar Danoun, an epilepsy specialized neurologist or an epileptologist, and welcome to the Epilepsy Encyclopedia, where you'll find all the information that help you to live the life of seizure-freedom. So let's begin. What types of epilepsy can oxcarbazepine treat? So oxcarbazepine is approved for focal seizures and focal epilepsy. It is FDA approved for adults, also in children 4 years and older if it is used as monotherapy, and 2 years and older if it is used combination with other medications. So here is the big mistake. Oxcarbazepine can worsen generalized epilepsy and even can worsen myoclonic jerks. So it is very, very important to know what epilepsy we are treating, focal or generalized. What other conditions can be treated by oxcarbazepine? Like many anti-seizure medications, oxcarbazepine can treat other conditions or off-label use. It can be treating acute mania, it can treat tumor-related seizures, also it can treat nerve pain, neuropathy, and some specific pain syndrome like trigeminal neuralgia. All these conditions can be treated by oxcarbazepine, but the main focus is focal epilepsy. So how does oxcarbazepine work? The main way oxcarbazepine works in the brain is by blocking sodium channels. So it is considered sodium channel blocker. So think of it as lowering the overall electricity in the brain that makes it harder for the seizures to start and spread. Compared to the first generation carbamazepine, it has less liver interactions and less interaction with other medications as well. So how to dose oxcarbazepine? One of the reasons that oxcarbazepine is widely used, it is ease of use and multiple formation. It's available as tablets, extended release tablets, and liquid form as well. So let's talk numbers. I will keep it simple. In adults, we start with 300 milligrams twice a day for regular release tablets, or 600 milligrams once a day for extended release tablets. Then we start increasing the dose every 3 to 7 days. I tend to increase it after 7 days to give the body a chance to adapt. Most people will end up with a dose between 1200 and 2400 milligrams a day. In children, it is always weight-based. We start with 8 to 10 milligrams per day, and we increase slowly every week. In elderly, they are usually more sensitive to medication, so we will start at a slower base. We will give about 300 milligrams a day and increase slowly to give them a chance to adapt. In kidney issues, since the medicine is excreted through the kidneys, we will adjust and lower the dose. However, in liver failure or liver issues, we avoid it altogether because it can cause liver toxicity. What if oxcarbazepine does not stop the seizure? There are multiple reasons why medications do not work. The first and most important thing in oxcarbazepine is to make sure that we are treating focal epilepsy and not incorrectly treating generalized epilepsy, because it can even make it worse. So that's number one. Number two, we make sure that we give enough dose. It means increasing the dose high enough and pushing to the maximum to make sure that we give it enough dose. And we make sure we give it enough time, usually between 2 to 3 months, to judge that the medicine is working or not. And at the end, missing medication can cause an issue. So make sure you're consistent on medication. And if you miss a dose, you always make it up. And the last thing, some people have what we call a drug-resistant epilepsy or medically intractable epilepsy. This is about 25% of the time that seizures do not respond to medications and might need surgical treatment. What are the side effects of oxcarbazepine? So the common ones are headache, nausea, vomiting, dizziness, imbalance, and double vision. Usually these side effects will improve with time, so we usually recommend to start low and go slow. But there are rare but more serious ones like hyponatremia, which is low sodium. So we always recommend to avoid drinking too much water with oxcarbazepine. Other serious skin reactions like allergic reactions like Stevens-Johnson syndrome, especially in Asian population. So we recommend to test them for that gene. It's called HLA-B1501, and it can rarely cause Dris syndrome. It also can rarely cause suicidal thoughts like all the anti-seizure medications. Oxcarbazepine can interact with birth control pills. What it does, it will increase the processing of estrogen. So if you have combined oral contraceptive pills, birth control pills, the effectiveness can be lower, and we recommend to always get IUD for a better treatment and birth control. Compared to carbamazepine, oxcarbazepine is safer, has less liver toxicity and interaction with other medications. Also, there is less potential for sexual dysfunction and sexual side effects than carbamazepine. So if you want to know what is the best medicine for you and what is the best treatment for your seizures, we can get one-on-one consultation. And to check that out, check the link in the description below and get your appointment today. Okay, let's talk how to monitor oxcarbazepine. So the good monitoring program looks like this. First, we start with genetic testing, especially in Asian population. We check them for these gene variants. We do blood work, starting with sodium, liver function, kidney function, and CBC in baseline and during checkups. Also, we check bone health by doing DEXA scan, especially if it was used for a long time, and we give supplements with calcium and vitamin D. And we always watch for rash and mood changes. Can I drink alcohol or drive while taking oxcarbazepine? For driving, we avoid driving first when you start the medicine because of dizziness and sleepiness. However, if you're having active seizures, you should not be driving at all. And regarding oxcarbazepine and drinking alcohol, it is recommended not to drink alcohol with oxcarbazepine because they can interact with each other. And I recommend overall to avoid alcohol altogether in people who have epilepsy. How to stop oxcarbazepine if it's not working for me? Like all the anti-seizure medications, we do slow taper of the medicine to avoid breakthrough seizures from that taper. The only time we stop the medicine suddenly is if we have allergic reaction. Is oxcarbazepine safe in pregnancy and breastfeeding? The good news is that oxcarbazepine is considered one of the safest anti-seizure medications in pregnancy, and it is much safer than carbamazepine for pregnancy. And yes, you can have breastfeeding with oxcarbazepine. We always just watch for baby sleepiness. So oxcarbazepine or Trileptal is considered the smarter, cleaner second generation of carbamazepine. And there is a third generation of carbamazepine. It's called islicarbazepine or Aptium. And we will talk about it in a future video. So make sure you subscribe to stay tuned for that. And there are newer treatments for epilepsy that are really a breakthrough in the treatment for seizures. You need to see this video to know all these new treatments that are coming and so exciting for epilepsy. And stay healthy and see you in the next one. Salam.